If you're just turning 65 and enrolling in Medicare for the first time, or you're planning to enroll in a Part D prescription drug program, you may be feeling just a little intimidated, but there is help at hand and at no cost. Sabrina Carr is benefits supervisor at our local Agency on Aging, Senior Services of Southeastern Virginia. And Sabrina, the idea of having somebody you can actually go to and know that they don't want to sell you something and and you don't have to pay for this advice is really, really good to know.
Absolutely.
And the services that you provide in terms of counseling are needed by quite a lot of people. I mean, Medicare is not a simple program.
Medicare is very daunting, whether you're new to Medicare, whether you're about to turn 65, you're about to retire, or if you've been in it for quite some time, the information that you get quite overwhelming, and so that's why we're here to really just help give some one-on-one counseling benefits to those in the community.
Okay, what are some of the things that people what are the most common things that people really ask for or ask questions about?
Just asking for some guidance on helping them decide on the right plan for them. As we know, everybody has different needs, different health challenges, and so we're there to really just guide them. We don't make the decision for them, but we just give them and make sure they're armed with the right information and make sure they make the best decision for themselves in terms of their Medicare benefits, also their Part D prescription drug plans. And we can sort of lay that out for them and compare plans for them and make sure they have the best information.
Right. Well, being familiar enough with the information makes it a lot easier than if you're just looking at all of it the first time. It's like, dare I say, buying a car.
Absolutely.
You know, it's really a very complex, situation, and it requires you to be knowledgeable about a lot of things that you haven't had to deal with before.
Yes. We try to tell people, because a lot of people that we're seeing, especially now with the baby boomers, are leaving their employers and sort of transitioning into Medicare, and we tell them, okay, so remember what your employer coverage was. Now forget it, because Medicare works completely different than that. And so we try to break it down in the most simple terms as possible so that they walk away knowing exactly what their coverage is and also how we can help them as well.
Okay. You can call Senior Services at their main number and then ask to speak to someone about Medicare counseling. You can also go online, and they have a great amount of information about all kinds of programs, including this, that you may want to explore. So take advantage of this. Even if you're not approaching 65, like within the next year or so, it's not a bad idea to start looking into it. Counseling services are available, I think, and make more sense for people that are really in that process of making decisions. But to educate yourself, you also have other means of for people to explore Medicare and kind of get the basic idea of what it's about.
Yeah, we do. We also do community presentations because our services are they're tied to Medicare, those who receive Medicare benefits, but our goal is really to also help family members, caregivers, because we know sometimes they are in a position to help their loved ones to make decisions for them. And so we want to make sure they have the best information as well. So we're out in the community, we're doing presentations, we're also doing counseling out in the community. We know some folks can't come to our office, and so we will do our best to come to you as well. So we're out and about in the community. All of our team members are sort of paving the way and making sure everybody has the best information possible.
You mentioned team members. So the team members, are these people in volunteer position?
We have some. We have some staff that are all certified benefits counselors, but we also, because we have a limited staff, we rely heavily on our volunteers. So we have volunteers that come in and help us primarily, they are throughout the year, but primarily during open enrollment, which is October through December. But we train our volunteers. They also become certified benefits counselors, and they help do exactly what we're doing, helping people really to just explain what Medicare is, what the benefits are, and how to enroll. They can also help them enroll as well. So those volunteers, as I said, we rely heavily on them, and they do exactly what we do in terms of meeting our clients' needs.
Okay, great. So there's always a call for volunteers too.
Absolutely.
Just thought I'd get that in there.
Yes.
Now, the program itself offers a tremendous service, an unbiased type of viewpoint on what you need to do, and that's not necessarily available anywhere else. And so the ads on TV may not really reflect generosity, as much as it is. We want to make money, and so call us. this is not based on that. We're talking about a nonprofit. We're talking
Yes.
about, this is for the good of the community. So certainly look into it. Now, there has been a bit of a snag in all of this, and that this kind of service is provided through funding that is
Yes.
approved by Congress.
Correct.
And right now, a subcommittee has Labor and Health and Human Services subcommittee has a proposal to eliminate
Yes.
this funding.
So they're currently in the process, that particular subcommittee is in the process of marking up their bills, which they do each session. And this is one of the pieces of funding that they're looking over. It could go to complete markup anytime between June 24th or July 14th. And the funding is in jeopardy of being lost, which means that impact on our agency as well as all of the area agencies on aging that provide this type of free Medicare counseling could go away. So we're just asking our community supporters, those who have taken advantage of the service, to just contact their congressman, their congresswoman, just to let them know how important this counseling is, because we do provide it free of service to anybody in the community, and we want to make sure that this is something that sticks around.
Okay, because there is a need.
Yes.
And sometimes that gets lost when
Yes.
you're in a subcommittee, but they're doing what they're doing, and
Absolutely.
it behooves everybody to become informed and see where this is and what it's about. So
Right.
educate yourself, and
Yes.
I'm sure that if you are still interested though in getting some kind of services, you can call. Don't worry about
Yes.
that.
Business as
It's
usual.
business as usual for everybody.
Absolutely.
And I know you need to get back to business as usual. So thank you for joining me and
Thank you.
sharing great information about Medicare counseling services that are free. Thank you, Sabrina.
Thank you.
We'll be back in a moment with news of free fun for teens, free summer meals for kids, and free movies and games, all in one beautiful and convenient location. Don't go away.